I'm very happy to sharing this conference and valuable meeting with you. I want to thank the Hospital of Sichuan North Medical University to invite me as a guest speaker outside China. I'm very proud for this, and I want also to thank Haifu Chongqing, all my friends on Haifu Chongqing, Professor Wang, Professor Zhang, Professor Ruzi, for giving me this very bright chance to share with you my experience. I am a lover of China, and I love Chinese people very much. They are warm people and friendly, and they help me till now. They help me all the time. So I wanted to share with you my experience about Haifu. I learned in China and applied in Egypt.
Yeah, we are so thank you for Professor Mohamed. Yeah, it's our great honor to invite you here. Yeah, for today's lecture about the use of hive in the Egypt. Yeah, if everything well at your side, if everything is well, yeah, we will give the time to you. It's time for you, Professor, please.
Okay, you can see my my share slide.
Yeah. We can see your PPT. Yeah, and we can hear you.
Okay.
Yeah, so
okay. I'm proud to be an Egyptian. I am a professor in the Cairo University, Kasrani Hospital. This is the biggest hospital and university in the Middle East and Africa. And I am working to introduce this technology to my motherland, Egypt. And this is our center slogan is Haifu Egypt, giving hope. Of course, I am very proud to be part of this technology. The motherland of this technology is China. This Haifu application is spreading all over the world. I have the honor to have Professor Wang and Professor Zhang, Professor Ruzi, and Professor Chen, and also all my friends from China and Thailand and South Africa, and to visit our center in Egypt and giving us the center of excellency for this. This is our center. It's a very nice, organized, well-established center using the HIFU technology to treating the people from benign and malignant tumor. In our center, we treated about 500 cases till now. Most of them are uterine lesions like myoma and adenomyosis, but also we treat about 200 cases from of liver cancer, cholangiocarcinoma, pancreatic cancer, liposarcoma, aggressive fibromatosis, bone metastasis, and also benign breast lesion. Our center in cooperation with the Haifu Chongqing, we open our center for the visitors from all over the world, from Africa, from Asia, from everywhere. And also we organized a meeting for the society, and I honored to be as a president of this conference, and we have all of our guests here in Egypt. Of course, the Professor Wang also visited all the universities and the big hospitals in Egypt and meet the responsible people and make a long discussion about the benefits of this technology. I wanted to explain something. I am an intervention radiologist, so I face a lot of complications and a lot of dangers when we treated many patients. We can use the surgical procedures, we can use thermal ablations and needles, we can hit a very difficult location besides the vessels and behind the bowel loops. So, and this is my background. My background is I'm an interventionist, and I am searching for another technology to solve the problem for patient we can't solve. So I am searching for the HIFU. I am not targeted by the company or the university, but I search what is the best solution for this patient and where is the best place. I found the best solution for some of cases I can't treat it is Haifu, and the best place is Chongqing in China. So I start my journey through this at 2012 to find a solution and trying to introduce this solution in my country. First of all, I want to show you wide spectrum of application for the HIFU. We have now many application of HIFU in neurological lesions like essential tremors, neuropathic pain, and Parkinson's disease. And this is not only applied as a clinical treatment, it's also FDA approved. The musculoskeletal pain and the musculoskeletal benign tumors and the musculoskeletal metastasis. It used now, the musculoskeletal metastasis is approved for the use by HIFU by FDA, and all of these applications used in Europe and in Asia. In oncology, and this is my domain, there is a many application for the HIFU treatment, and there is FDA approved in many application also. The uterine fibroid is the diamond piece of the HIFU. We can treat the patient very nice and the good experience. We have also uterine adenomyosis. I want to show you with this very wide spectrum of application. And second issue, we have a lot of patients treated by HIFU across the world. It's more than 250,000 patients. This is the only registered patient. And I think this number is multiplied by 2 or 3. It's about maybe reach less than 1 million patients treated by HIFU. So we have a very good tool to treat the patients. You can see also the gross of the usage of HIFU. It's significant. At 2013 and 2018, there is big difference between the clinical usage and the number of the centers and the number of disease treated by this application. Also, of course, we can't deny the importance of the financial issue and the manufacturing. The manufacture, there is about 28 manufacturers all over the world going through manufacture the HIFU machines. And this is very important and increasing. And this chart showing us the application, the medical condition treated by HIFU in North America, in Europe, and Asia. You can see the Europe is the most applied place for HIFU, not China. And this is very good. And this is a credit for the HIFU technology. You can see in Europe, they almost use the all application of HIFU at wide range of application. And I am very proud to that. This is the China Chongqing machine and China Chongqing technology. I think this is the technology. This is not a machine. It's the leading marketing all over the world. So this is very important. First of all, we must know how the HIFU work. The HIFU working by many mechanisms. Not only, this is not only a thermal issue. The HIFU working through tissue destruction, immunomodulation of the tissue, and making a pores in the cell membrane of the cells and the capsule of the tumor, improving the drug delivery and immunotherapy delivery. So tissue destruction, pseudothermal, histotripsy, microvascular disruption, immunomodulation, and this is very important by tumor cell disruption and the augmentation of immunotherapy, and also chemotherapy drug delivery. So we have a mechanical destruction, we have a drug delivery effect, and we have immunomodulation effect. And at the end, the HIFU works by more than 13 mechanisms, not only as a thermal ablation. Before we working with HIFU, we must know very well the anatomical details, how to make a position, suitable position for the lesion. We must know the surgical approaches for treating these lesions, the direction of the power, and this is very important. So the role of engineers and the HIFU technology is very important. We need all the time what is the power, what is the direction of the power, and of course we need to treat with the least power. This equation is very simple. I formulated. We have distance, size, and vascularity. When the distance is less from the skin, when the size of the tumor is less, when the vascularity is less, we will have better effect and less time. So it's related to distance, size, vascularity. And this is the HIFU theory. It's very simple, like a concentrated lens accumulates the power at point with distance from 12 to 16 centimeter, leading to heat ranging from 56 to 100. And of course, the HIFU is a semi-automated process. In spite of the machine is very important, but the vision and the human factor is very important to make the tumor ablated very well. We can reach a very difficult location like pancreas, liver, very easily with very clear vision. Of course, all over the world, the most famous is ultrasound guided and the MR guided HIFU. There is a privilege for ultrasound guided. It's very easy. It's very cozy. You can manipulate the patient at very wide range of positioning. You can assure the patient because you are at the same room, and it's suitable for difficult small lesion in difficult location. Usually, we put the patient in prone position if the lesion in the upper abdomen or in the pelvic region, but sometimes we make the lesion in prone or left lateral or right lateral according to the location of the tumor. So it's very important to make a positioning very well. Sometimes we use the accessories to compress the bowel and as well. The machine of HIFU is working in 9 axes. You can position the patient and move the machine and target a very difficult location like this area. It's pancreatic tumor. Average time is about 2 hours to treat a pancreatic tumor, and this is very little time for treating pancreatic tumor. Maybe the operation lasting up to 8 to 10 hours. I'll start with adenocarcinoma of the pancreas, as it's one of the most aggressive cancer, and the overall 2-year survival less than 10%. And most of the patients are at unfavorable performance status. They are old people with comorbidity. Also, there is a very, very complicated anatomy, a lot of vessels, a lot of biliary tree, a lot of bowel surrounding the tumor. So it's a very, very difficult tumor to treat it. And also, we have another problem. There is only few numbers of chemotherapy accredited agent to treat the cancer pancreas. And the morbidity for the surgery is very aggressive. And also, we must know the HIFU is FDA approved as a technology. The alternative for pancreatic tumor, what we call the nano knife, it's a very difficult technique. I treated the patient with this technique. It's a very difficult technique and very traumatic. Most of the patients need to stay in the ICU for 5 days to 1 week. with hemorrhage incidence. The cancer pancreas, we have a very nice experience for cancer pancreas in Egypt. We treated now more than 100 patients. And this is a very good number with very reasonable results for this. The HIFU is non-invasive, rapid pain relief, very high safety. And this is one of the most important paper talking about the safety and accuracy of HIFU in cancer pancreas. I'll go through this very fast to show you the wide spectrum of our application in Egypt. This paper is very important. It's a systematic review talking about the application of the HIFU in pancreas. You can see most of the machines is ultrasound guided, and this is only one paper talking about MRI guided HIFU. And the patient number is chosen at this study showing improvement of pain in 80% of the patient and the tumor reduction. Very important, we must evaluate the patient. We must aware about the acceptance criteria for the patient. This study we published in MIUN in the United States, talking about our experience, how to use the color Doppler for guidance for HIFU. You can see this is a cancer pancreas. This is a male patient, 59 years old, with large pancreatic tumors encasing all the celiac tree and causing a lot of problem for this patient, not receive chemotherapy and with progressive course. This is the tumor before, it's a large one, and invading the whole pancreatic tissue and surrounding the vessels. This is after second session. You can see the tumor size is significantly reduced. After 3 months, is still reducing. After 6 months, we can hardly differentiate it in the MRI. And after 9 months, the PET scan is cancer-free. This is very astonishing. The patient received chemotherapy for less than 1 year and a progressive course. When we add a HIFU for 2 sessions, the tumor is completely disappeared. This is another lady, 54 years old. This lady is Egyptian lady treated in USA and received chemotherapy with very progressive course. You can see this is a large tumor with very painful back pain, and received a lot of painkillers. And this is the tumor, this is aggressive tumor. And you can see after this tumor is reducing in size. This is the first, and this is the second. This is also another guy complaining from uncinate process small tumor. You can see this is the uncinate process renal tumor, and we targeted by HIFU. And this is the effect after the HIFU. And you can see after 12 months, the MRI, you can't even identify the scar of the pancreatic tumor. It's completely disappeared, Another issue in Egypt, and I think we shared about this, is the liver and cholangiocarcinoma. It's a very important as a cause of death. It's maybe the 5th cause of death, of cancer-related death in the male, and the 7th in female. And the issue about the HIFU in liver, is it safe and we can treat it in spite of REB, or what is the result? I have this experience. I faced this experience at 2004 and 2006 because I am starting to work with radiofrequency to treat the HCC and the liver cancer. And this is also a common question. Does it really work? Is it really efficient? The same for the HIFU. This is a study from one of the respectable universities all over the world. This is at the Hong Kong University, Queen Mary Hospital. they talking about the comparison between the usage of HIFU and the usage of RFA in the small HCC, and they found that the HIFU is comparable with the gold standard technique for HCC, which is the radio frequency, and even in some aspect, they can found the HIFU is better than radio frequency, and this is very important. I can show you some of our cases. This is a small liver metastasis from colorectal cancer nearby the portal vein, at the confluence of the portal vein with this young lady. We starting one session of HIFU, and this is immediately after HIFU by ultrasound. The treatment lasts for 1 hour. And this is the MRI after the treatment. It's complete ablation of the tumor with very safe portal vein and the skin, and nothing occurred. Another lady, 37 years old, with a small metastatic lesion at the left loop segment 3-4 lesion. And this is during HIFU. It talks about 1 hour or less than 1 hour. This is after the lesion. This is after the treatment. We can treat the lesion, and even we can found that there is a hemorrhage within the tumor, and this is the most successful sign in the ablation. If you ablate the tumor very well, the inside cells will rupture and forming a small hemorrhagic coagulopathy. And this is a very good sign for treating the tumor. This is also another metastatic lesion at very difficult location nearby the bowel. And you can see the efficacy of the HIFU. At HIFU treatment, you can even make like a wedge-shaped ablative zone. And this is very, very nice and very efficient. This guy came to us from Yemen, outside Egypt. He complaining from central cholangiocarcinoma, and this is very difficult tumor to treat it. The surgery is impossible because the tumor is central and invading the right and left loop. We put a metallic stent and treating the patient, and you can see the effect of the HIFU after the treatment. The tumor is vanished, and this is the artifact of the metallic stent, and you can see the tumor is vanished. This is very, very nice. We saved the life of this guy. I'll show you another, the common application of fibroid in Egypt. In Egypt, we have a special consideration for the HIFU patient. The age of the patient usually young. Usually our patients are virgin because they are not married, and we have, so there is no sexual life, and we have, most of them are obese, complaining from uterine bleeding, discomfort, and primary infertility of some of them. Usually the myoma is multiple, and after treatment, we have 7 HIFU baby from infertile ladies. You can see, I'll show you many, most of the places we treat. This is an anterior wall fibroid. This is a fibroid. This is during the treatment. This is a complete, almost complete ablation after the treatment. Another lady of posterior wall. I'll show you the variety of the location of the HIFU anterior wall. This is posterior wall fibroid, and almost more than 90% ablation. Sometimes the heterogeneous tumors, some people talking about it's not suitable for HIFU. No, this is a heterogeneous tumor with different zones of hypervascularity and less vascularity, and this is after HIFU with very good response. This is a multiple fibroid tumors. At same session, you can see multiple fibroid tumor treated at the same session. Also, this is a very big cervical tumor, and this is a very difficult location to treat because it's very painful. And this is a virgin lady complaining of cervical fibroid. We treated, and you can see after the treatment, almost 85% of the tumors ablated. And this is a marvelous result of this fibroid, large fibroid, changing the shape of the uterus after the HIFU, and this is 6 months after the HIFU, the uterus regain its normal shape, and this is marvelous, and the tumor is disappeared completely. But this is not occurred in all the patients, but this is a very successful results. Sometimes the patient no need to make a complete ablation. You just need to decrease the symptoms. As you can see, this is a large tumor. We treated only, we have about 50% of ablative zone, but the bleeding is stopped and the patient is improved. There is a new emerging application of the HIFU for pediatric age group, and this is very important. And we must increase the application of HIFU in everywhere. Now, the HIFU is one of the important tools in treating of benign osteoblastoma and, of course, extremity, low vascularity tumor, and aggressive fibromatosis. I'll show you some of our cases. This young lady, 5 years old, complaining of lymphatocavernosus malformation in the neck, and it's very difficult, not candidate for surgery. It's not safe for sclerotherapy percutaneous. We starting to treat this girl and with very low power HIFU, and you can see she even can't extrude their tongue, and this is after one session. The reduction, significant reduction of the size, and she can extrude their tongue. This guy came to us from Iraq, complaining from aggressive fibromatosis with very high vascularity. I made first angiography to show the vascularity, and there is very faint vascularity, and I inject some particles to occlude this vascularity, and this is during HIFU. You can see the effect of HIFU, and this is a very nice response. At one session, we can ablate about 50 to 60% of the lesion. This is another female lady with aneurysmal bone cyst and affecting the iliac bone with air fluid level at ultrasound. We start to make a HIFU and waiting for the result. So the HIFU is one of the most important tools will be used in the future as a surgical tools at the adjuvant for chemotherapy, as a very important adjuvant for the immunotherapy. So sharing with us the future and sharing the patient hope, I think the HIFU will introduce a new hope for many of the patients. It's a very precise, very nice choice for most of the cases. Thank you very much, and I am happy to sharing my experience with you.